All right, good afternoon, everyone. Thank you so much for joining me today. Looks like a couple people are having trouble getting in the session, so I'm going to post the correct link to the session in the chat box. So if any of you hear any problems, with anyone getting in, everyone has it. 1 second. And actually, Erin, if you don't mind shooting out an email with that correct link to our office, I would appreciate it, just in case anyone calls. All right, so first things first, welcome to the Journal Club session on graphic medicine. I'm Amy Gogan. I'm the Data and Evaluation Coordinator for the Southeast Atlantic region. Before we begin with the club, I have a few administrative things I'm going to run by you. I have included a couple of questions for you to consider before we start the webinar. If you'd like to share any activities you've done or resources you've utilized related to graphic medicine, please feel free to share those in the chat box. Also, as you're sharing, communicating, and asking questions in the chat box, please make sure to send to all attendees so that your colleagues and I can all see your questions or information that you've shared. If you need closed captioning for today's webinar, I'm going to go ahead and post the link to that in the chat box. All right, so thanks so much, everyone, for attending today's presentation. As a reminder, the presentation will be recorded and put on our website. All right, so today's Journal Club is on graphic medicine. This is me. Welcome to our Journal Club session. I'm Amy Gogan. I'm the Data and Evaluation Coordinator at the Southeastern Atlantic region of the National Network of Libraries of Medicine. So for today's discussion, we're going to just talk about the article first, introduction, methods, results, limitations. Then we'll have a group discussion, and I really encourage everyone to participate. I really appreciate that. And then we'll just have a little bit of a closing. So the article that we're talking about today is titled "The Potential of Educational Comics as a Health Information Medium," and the author is Sarah McNichol from the Education and Social Research Institute at Manchester Metropolitan University in Crewe, UK. So the reason that I selected this article is because I have a personal interest in graphic medicine, and also because the National Library of Medicine has a traveling exhibition on graphic medicine along with some great online educational resources. The exhibition is called Ill-Conceived and Well-Drawn, and it was curated by the artist Ellen Forney, who's the author of Marbles. The exhibition showcases items from NNLM's collection of graphic memoirs. It also includes educational resources, including a lesson plan for grades 7 through 10, as well as a module for college and professional students. The university module was developed by Dr. Michael Green, who's one of the founders of the graphic medicine field and who has himself used comics in medical education for many years at his institution, which is the Penn State College of Medicine. So for those who were not previously familiar with the subject, this slide very briefly describes graphic medicine, but it's really a difficult field to define because it has so many facets. We actually have a few experts in the group today who might be willing to talk a little bit more about that later, which would be excellent. But essentially, graphic medicine is the use of comics to tell stories of illness and health. The term was coined by the doctor and cartoonist Ian Williams in 2007, and M.K. Serwick, who's also another preeminent person in the field of graphic medicine, defines it as the intersection of comics and the discourse of healthcare, but it's a pretty broad term that includes the use of comics in different aspects of healthcare. So the author of this article provides this definition of educational comics. So educational comics are a subset of comics whose purpose is not to tell a story or entertain, but to transfer information or communicate concepts. So to summarize the author, there are several uses of educational comics, including raising awareness of illness, preparing patients for what to expect with their illness, helping patients to make decisions about care, improving their ability to manage chronic conditions, and promoting increased acceptance or understanding of the condition. So educational health comics have both therapeutic benefits and benefits as a health literacy tool, and both of these types of benefits are important. However, previous studies to this study have mostly focused on evaluating how well these comics communicate facts. So this study's aim is to address the imbalance in the research. So there are two objectives as stated by the author to this research. One is to investigate the ways in which educational comics might provide support in dealing with feelings and attitudes toward health conditions, as well as improving understanding of factual information. The second is to identify any potential weaknesses comics may have as a medium for health information. So first, we're going to talk about the methods. So the participants in this study were students from Manchester Metropolitan University in the United Kingdom. There was 1 man and 10 women, and their ages ranged from 18 to 34 years old. These participants all either had a health condition themselves or they had a relative with a health condition. The comics used focused on 8 different health conditions, and they all included an educational or informational aim that was greater than or equal to the literary or artistic aim of the comic. The participants took part in a 45-minute semi-structured interview, and prior to the interview, the participants were assigned a comic related to their condition to read. During the interview, they were asked questions about their general views about comics and health information access, as well as specific views of comics, including what their opinion was of this format as a health information medium. The interviews were then recorded, transcribed, and analyzed using NVivo qualitative data analysis computer software. So the results were broken into a few major themes. The first theme was the effect of narrative and characterization. So interviewees felt that health information presented in this form might be easier to understand and more relatable. They expressed empathy toward the characters in the narrative, and some also believed that their personal connection to the characters might enable them to better relate to, respond to, and remember the information. Some also felt that they had gained a new perspective on their or their loved one's condition. Others expressed the belief that comics can validate individual experience of illness and alleviate feelings of isolation. However, there were several factors that limited the interviewee's ability to relate to characters and narratives, including age and gender. So the next theme is the role of images in comics. Participants expressed that images were more powerful than words, and they felt that they could be more effective than written health materials. They also felt that the images were useful in supporting and reinforcing written word and explaining complex ideas. The use of visual metaphors in the comics engendered empathy, recognition, and self-reflection, but dark or confusing images sometimes had a negative impact on interviewee mood. Next, the results section discussed the potential social and emotional benefits of comics. These included reassurance, increased self-awareness, possibilities for raising awareness about a condition, and encouraging discussion with providers and family members. One disadvantage they found is that comics raise sensitive issues that might be upsetting to people. Interviewees expressed that they believe that comics should be realistic, but also have an overall positive message. The participants in the study did not report gaining any factual knowledge, but that was found to be because they already had a good understanding of their health condition or that of their loved one. But instead, they did increase their self-awareness of the feelings associated with having a health condition, and they were often enthusiastic about the potential for others to better understand health conditions through comics, to their family members or members of the public. Another section is, was the potential problems with educational comics, and two concerns that the researchers identified were that there is poor access to comics about health conditions in general, and there are also generally negative perceptions of comics about health conditions that need to be overcome, though some of the participants did change their views while participating in the research. Other potential problems are that some conditions are well represented in comics, but others are not. So some of the potential limitations of this study was that it was a very small study, just 11 university students. They were mostly young women. None were regular comics readers. They were generally highly educated, and most already had a good understanding of their condition or their family member's condition. So next, I'm going to open things up for discussion. I have a few slides of discussion questions that were submitted by participants in this journal club today. I think that what I'm going to do, if everyone's paying attention, and hopefully they are, I'm going to try to unmute everyone, and we'll see what happens. So I'm unmuting everyone, so please mute yourselves once I unmute you. So we're going to try this out. I'm unmuting everyone.
Have a good afternoon.
Can everyone unmute themselves? Please, yeah, everyone mute themselves, or I will mute you. Okay, anyone who doesn't mute themselves in the next minute or so, I will mute. Okay, all right, I'm going to go through and mute everyone else. I'm muting everybody. Okay, all right, so I think that now people can just unmute themselves and talk. So we're going to try this out. I've actually never done it this way before. So these two questions were kind of similar, so I thought I'd put them on the same slide. And they both address the gender imbalance in the research study. So the first question is, the research study had 1 male and 10 female participants. Is it possible that this lack of balance between the genders impacted the results, considering men are often socialized differently than women when it comes to reading? The second was similar. Do we think there's a difference in the English population in general between men and women as far as their attitudes towards graphic novels or comics? So if anyone has wants to talk about either one of these questions or something else in the article, that is great. So whoever's ready, go for it.
Patricia here.
Hi.
You know, I think the questions are kind of like setting it up because there's so much research that shows comics are used specifically to reach out to young male readers who are struggling to learn to read. So there very clearly is a difference, and there's a lot of research to support that. So I would think it would have an impact probably as much as a small study, and you're looking for can you replicate, or can we do other studies, or can we get bigger studies?
Okay, that's a great point. Anybody else? I also just want to remind everybody, if you post in the chat, make sure you drop down to all participants or only I can see. It's automatically set just to go to me. So if you submitted a question, make sure you resubmit it, send to all participants. Okay.
This is Sarah from NNLM NER, and I thought it was interesting what the article was saying in general about the attitudes, because anecdotally I've heard the same things from, we run a book club kit, and graphic medicine is one of our special initiatives. And so I've heard a lot of the same things, and we use them in the same ways that the article put forth. And then the barriers were a lot of the ones that we hear from people. Oh, our institution doesn't take comics seriously. Oh, you know, comics can't be serious enough to educate on these topics. So what people were saying about having it replicated is definitely true, because it's such a small study, not just in terms of the balance, but also anecdotally, I think we've seen, or I've seen, some of the same responses from people.
Okay, great. Has anybody else? Oh, go ahead. Has anyone else had similar feedback to Sarah? And actually, we can come back to this question, but the next question actually addresses this a little bit here. So there are certain prejudices against comics. So how can we, as health sciences librarians who are enthusiastic about graphic medicine, how can we address the stigma and overcome that?
Well, for me, my experience is that people, you give them an example. You put it into their hands, and when you put it into their hands and show them, they kind of have this, I mean, as stated earlier, the fact that there were people who changed their minds in this study, during the study, about comics, that a lot of people have these preconceived notions, and then you give them examples and they see, oh, okay, I see that they're not all superheroes, they're not all for kids, and are often incredibly surprised when I talk about the kind of content and the subject matter in the comics. And I think just showing people examples, good examples of comics, and that it can be very powerful.
Okay, great.
This is Patricia again. And I agree with what Alice said. One of the things I try to do to reach out to academic types is go into some of the specifics of visual literacies that are part of comics and how those literacies impact on high-level critical thinking and analyses of the comics and the structures and how they are created. I also show them, you know, the one very famous PhD thesis that was done as a comic, and that usually, that sort of quiets things down. They go, somebody got a PhD for a comic, and I go, yeah, and here's the coloring, you know, a coloring book that was done as a master's thesis, and here's a variety of visual literacies that, and I will also talk to them about the trends in visual literacies and how that impacts on the future of information provision and our profession, and the sort of things that the National Library of Medicine is looking at and the American Library Association are looking at. And at that point, they're kind of like, oh my God, this is so much bigger than I thought.
Okay, great. Thank you, Patricia. So I'm thinking maybe we should talk a little bit about the study too, did anyone have any other limitations that they found that they thought maybe questioned the validity of the research, or they weren't really sure about?
This is Nina, and I didn't really feel like they were very descriptive about their thematic reduction and their qualitative techniques. Their methods is just, I can't say if it's valid or not, because there's so most of the information is on the sample, and then they just say, we transcribed, we loaded them into in vivo, and we inductively coded. And that's, it's not what I'd call very robust description.
That's a good point, and a few people asked me if I had a few questions about seeing the actual interview questions exactly, and I, as far as I know, they weren't available anywhere, the actual questions that were asked. That's a good point.
Yeah, that too. I mean, there's not an appendix, there's not supplementary data, there's very little on the methods. I mean, anyone could sort of say they don't talk about piloting the instrument. They don't talk really much about how they derived the instrument. So it really looks like something anyone might have decided, I feel like I'll ask the questions that I sort of feel like doing, and then I'll pull out the stuff that I think looks kind of common, and I'll pick the quotes that I like, which there's nothing inherently wrong with it, but I wouldn't call it highly valid and transferable necessarily.
Great, thank you. Anybody else?
Yeah, this is Sarah. I also had a question about how they chose the books they gave, because they had that one sentence about health content equal or greater than literary value, and a lot of the books that are out there and that are most interesting to people have a very high literary value to them. They're, published by these very mainstream publishers, and therefore I think if you discount ones that have high literary value, whatever that means, then you're discounting a lot of the ones that have that engaging factor that would really bring people in and have them identify with the protagonist.
That's a good point. And I didn't see an instrument for determining which comics met that criteria of an equal or greater educational value to their literary or artistic value. Anybody else see any concerns with the study design itself?
I think there's an interesting conversation going on in the chat box about ageism, because the other thing is, but I just wanted to bring attention to that, because the discussion is about whether or not younger readers would be more inclined to believe in for lack of a better term, believe in a graphic novel. But I think the other thing is that there are not as many, or at least I've been having trouble finding age-appropriate graphic novels for kids, or graphic medicine novels for kids.
Yeah, actually, I can't see any of those messages about ages. I'm not seeing those if they're there. So yeah, that's a good point. That a lot of at least the ones I know of are for adults. I know there are a few kids ones. There's actually, I don't know if Alice wants to talk, but Alice knows just about every single graphic medicine title there is, so she might have some ideas for some more children's titles, which she doesn't have to mention now, but if she wants to. Sorry to call you out.
I'm not sure I would say that I know every graphic medicine title out there, but I do have a database, and I do know it's roughly 275 titles. I have not read them all, but I have read about 100 of them. And there is a wide range. I would say the shorter ones and the ones that aren't necessarily available to everyone, like not something that you can purchase and keep in your library, those are more for kids. And a lot of the ones that are purchasable through major publishers are for adults. And I say that very strongly that many of them have very intense themes, including, rape, alcoholism, mental health issues, death, the list goes on and on. But I would say that, because I was kind of in the chat discussing the ageism, that I feel like comics have gone in and out of being acceptable, and there was a time that they were completely unacceptable, but a long time ago, before, well, it went in and out of different points in history, but it's all about access. So someone brought up that they had graphic novels comics that were major literature classics in comic form, and that has gone in and out of style too, and in and out of print. And me personally, I would fit into the category of millennial, and I was very much, I mean, my parents never said anything, but they weren't available in the library. They weren't really available in the bookstores that we went to, and in school, we were actively discouraged from reading comics, graphic novels. So it wasn't until I was much older that I kind of got over my stigma, my personal stigma. I'm very glad that I got over my stigma because I'm obsessed with them now. But I think that it's not fair to say any sort of ageism. But I would say, and this goes back to the question that my question was briefly on the screen, but Raina Telgemeier has, so for the kids that are growing up right now, there's so much out there. There's so much out there for them, and it's more than just superheroes. There's such a wide variety, and it's so much more accessible, especially because of the internet. Yeah, that's my question. Because of the internet, that they have less stigma against them. But I think that it has gone in and out of vogue, in and out of acceptance.
Great, thank you, Alice. So just one more time, if anyone's chatting in the chat box, change it to all participants, because I can't see it if you do all attendees. But I mean, unless you don't want to hear me here, which is fine. But otherwise, please change it to all participants so I can see what you're writing and I can address it. So does anyone else have any personal experience with comics, or they weren't sure about graphic novels before, but maybe now they've read this article, they have a different opinion?
This is not answer to that question, but all participants is grayed out on my menu. Just.
Oh. Well, I probably did something wrong, but okay. Sorry, I'll try to fix that. Matthew, go ahead. I just saw you pop up. I can try to fix the chat while you're talking.
I was going to say that the all participants thing too. But I also wanted to, this is really, I guess, turning back to the limitations piece. I want to push back on this. I'm curious what they mean when they say they're not comics readers, because at this point in time, if you're on social media, there's a pretty good chance that you are in some capacity a comics reader, because if everyone's sharing webcomics nonstop all the time, and those count as comics. So that's just one of my pet peeves that I have to throw out there.
Okay, thanks, Matthew. I agree. Anybody else? And I fixed the all participants thing, I think. this is my first time using WebEx by myself. I don't have training wheels, so I apologize for that. Any other thoughts on comics in general or opinions towards comics?
So the question about evaluation was something that came up at the Comics and Medicine conference last week. And I know that it was more a question of how do we evaluate the programs and the comics themselves, so sort of along this line, but also is it enough to say, oh, it made people feel better? Is there a way to do it quantitatively? Is qualitative enough? And so that was a question that came up a lot, especially when talking to creators, because there's a sort of a third level that those of us who aren't creators don't really see, and that's the therapeutic nature of actually creating the personal comics. And so then there's that other layer of how do you evaluate that as well. So I just wanted to throw that out there.
Yeah, that's a great point. And if any of you aren't familiar so much with graphic medicine, if you take a look at the NLM site that I mentioned earlier, which I will link to, the university module that it was created by Dr. Michael Green, part of what he does in his classes is he has medical students write about their experiences, and that's not the only way you can get a therapeutic benefit from creating your own comics, but that's one way that is done, and it's a very interesting. It's very interesting how the results that they get from that. Right. Oh, thanks, Matthew. So anyone else have any comments in general about, or specifically about the article? So since actually these two questions on the screen, they weren't the only questions that had to do with the men and women socialization. It's kind of interesting that people brought that up because I know Patricia mentioned that a lot of, oh, don't be sorry, Patricia, because that was my fault. So you guys couldn't see all participants. That was on me. Patricia mentioned that there are studies that have been done on using comics to help young men understand communicate to communicate information to young men. So that's a thing around 2010. Okay. So clearly the comics, it seems like comics do have pretty broad effectiveness. So as I know there are a few people who in this room, I know Alice did mention what she's done, Patricia mentioned what she's done. Has anyone else either personally had to overcome the stigma surrounding using comics or images for education or communication, or does anyone have any ideas about ways that we could overcome these stigma? And one thing that Alice mentioned a little bit, if anyone's not familiar with Raina Tellemeier, she is a, I guess I would say middle grade author who writes graphic novels. They're really, really, really popular with, I would say, like maybe 8 to 12-year-olds-ish. And I think there are a lot of younger people who have grown up reading graphic novels, and their parents are becoming more accepting of them, and it's been more widely understood that comics are, it's okay to read comics as you're still reading. So I think definitely it's possible that people who grow up with comics and more acceptable, felt that they're more acceptable, might be more inclined to think that they're a good medium for health information literacy too. So this author that I'm mentioning right now is Raina Tellemeier. And it's in the second question, the last line. So Patricia mentioned a book called Terms and Conditions to Graphic Novels. So this could be an interesting way to engage people around visual literacies, how they can impact understanding and engaging with challenging content. All right, that's great. And Jessica thinks that medical libraries can get the consumer health information from comics. I think that's really a good point. Has anyone here either used comics for consumer health information or have any experience with it?
So the book club kits that I mentioned earlier, the way we do them is you get 6 copies of the book on whatever health topic, and then there's a folder where you get handouts with the consumer health information that's related to that topic. So Medline Plus, CDC, I know for Marbles we have some stuff from NAMI, and so to pair the graphic novel with the consumer health, and so you get sort of that more personal feel that you wouldn't get with the health, the facts, but then also to make sure that you have those, you know, these are what the symptoms are, this is what the treatment is, this is to make sure that you have both of those things.
That's great. And so if anyone is in the New England region of NNLM, you can request those book club kits. I have a link to them at the end of the presentation, so if anyone's interested, they're terrific. Let me flip to another question. Oh, go ahead.
One of the things I've been thinking about is if you're familiar with rarediseases.org, one of the things they do is have streams that feed into different disease topics that sort of auto-populate. And I was thinking if we had a way to, you know, take Alice's database or build it out or whatever and take the conditions that are mentioned and automatically feed them into Medline Plus or something like that, to partner with NLM on attaching the graphic medicine suggestions to the appropriate content.
That's a great idea, Patricia. And in fact, so if you go on Medline Plus, the health topics pages link out to many different National Library of Medicine databases. So it could be interesting, especially if a graphic novel is in NLM's collection that they have, linking from the medical topic page to the graphic medicine exhibition. That's a really interesting idea. I love that idea. So someone sent this question in, and they asked about whether or not graphic novels are the right medium for mental health issues, since there already is stigma when people are faced with mental health concerns. There's a lack of adequate care, and the question is, would an educational comic be viewed as a credible source for information? So I guess if we're really dividing comics up into 2 different categories, which I don't know whether we should, educational or artistic literary, which I think most of them really straddle that line, there are many, many, many graphic medicine titles about mental illness topics. There are tons of them. So does anyone have an opinion about this question, want to make a comment?
So this is Matthew. I guess my sticking point with this question is about what information we're talking about. So if you're looking at these from an information perspective about what the patient experience is like, then they're definitely a credible, valuable medium. But if you're looking for a set of facts and figures and data about a condition, then it's a toss-up, and I'm not so sure that comics are always the best place for that right now. And then that's the question of what do you want to get out of these books? I approach them as a way to share the patient experience and to get what it's like to be in the moment with an illness out there, less so for factual information.
Yeah, I think that's a really great point. I think there's definitely potential for patient education materials to incorporate comics when possible, but you're right that it, especially as they stand now, it really makes more sense for these titles about mental health to be more patient experience centered, which is certainly valuable itself. So in the chat, Darlene asked what the general reading level of adult graphic medicine materials are. So we've got 7th grade, but it varies. Yeah, I would say a lot of them that I've read, especially the graphic memoirs, are definitely a higher reading level. I'd say high school or more, at least, I mean, not all of them, but they're, as Alice said, they definitely vary. And April says, yeah, experience can help inform facts, like a visual representation of the facts. That's definitely a great point. Does anyone have any other comments about mental health and graphic novels, graphic medicine?
I feel like there's been, not in graphic medicine, but generally in comics, that there's been other treatments of mental health that were fairly serious. I mean, I'm going to show my age and mention Mouse, which talked about trauma a lot, and then I'm going to show that I'm a geek and mention hyperbole. Oh golly, it's just escaped me. The comic that has the clean all the things in it, which talks about the personal yes, hyperbole and a half. Thank you so much, everyone. That has a lot of discussion of the author's mental health concerns and experiences. So it seems like it works for some people.
Great, thank you. Alice, is that a hand? Go ahead. Go ahead. Oh, well, there. Alice, you can go ahead if you're trying to talk. I don't know if I'm supposed to hit the hand or not, but you can go ahead. Oh no, we can't hear you, Alice. That's weird. Sorry, Alice, I don't know what's wrong. You shouldn't be muted or anything. Okay, well, sorry, Alice. I can hear someone is oh, I just unmuted everyone. That was because of me. Okay, I'm muting everybody again. So unmute yourselves if you want to talk, or raise your hand and I'll do it if it doesn't work. All right, I'm going to move on to another question. Okay, so these are also kind of related questions. How can medical or health science librarians educate their patrons or customers the benefits of educational comics, graphic medicine? How can we partner with faculty and students to create educational comics? How can we assess the impact that it has on our communities? And then similarly, are there any ways that people in this journal club are working to help their institutions realize the full potential of comics in the health setting? Oh, Patricia, you can't unmute yourself. Okay, sorry about that. I'm unmuting you. If anyone wants to talk, just raise your hand and I'll unmute you. But go ahead, Patricia.
I've done a lot of partnering with faculty and students on creating comics, so I wanted to just touch on that little piece of it. And one of the ways that you get in is by sharing research and stuff about the potential, sharing findings from the conferences, talking about the different kinds of literacies involved, and I think also giving the examples on reflective learning that Michael Green's group has been doing. Those are fantastic for getting them sucked into the idea of it as a valid way to communicate. And helping to design methodologies or research studies that look at how to assess their impact is also part of showing the value of what we can bring to the table with it or getting them engaged with it.
Great, thanks, Tricia. If anyone else has a comment, please raise your little hand and I will unmute you. Tess, go ahead.
Hi, yeah, this is Tess. I think one of the ways, and I think this was mentioned earlier in the chat, was just having someone in the graphic medicine field come in and talk about it, hopefully, preferably somebody who is either or also an academic or is also a clinician. I think other clinicians or similar other academics can relate more to people that are in their field as opposed to just like as a librarian going out and saying like, graphic medicine is awesome, you'll find it really useful. I feel like that's one way of doing like a big outreach. I know that I've just done just today, I had an individual outreach where somebody was interested in, is doing a presentation on communicating with patients and having those difficult discussions with them. And I was like, hey, we have this graphic medicine collection. You should, with lots of graphic novels about difficult conversations. You should check it out. So, yeah.
Tess, would you mind talking a little bit about graphic medicine prescription? I know you mentioned it in the chat box, but I'd never heard of it before.
Okay. This is just something that I've been rolling around with in my head because we have an upcoming, the traveling exhibit is coming to UMass Medical School, and so we've been thinking about outreach, and we had debated about outreaching to support groups, but that didn't, we couldn't really, we're having trouble thinking about like how we would do that. And I was just thinking about, you know, it'd be funny to like make up a little prescription card and have prescription books about X topic. And I just wasn't sure if somebody has done that before. So, and I see in the chat that I think, Patricia, you said that
Yes. I do, and I have quite a bit. It's
yes, yes. Do they actually look like little prescription notes, or do they?
It's more like reference questions that people come in and say, do you know of anything on? And I know Matthew and Alice and I have answered questions like that have come up via Twitter. When it comes up here, if I can, I try to get them into my office so that I can show them different examples and get ideas about what suits them and what works for them. But it's a reader's advisory question.
Right.
It often has a personal basis where they're going, my mother-in-law is dying, or my father was just diagnosed with cancer, or my kid was just diagnosed with epilepsy, or, you know, do you know of something for, and that's where it comes in.
Yeah, I was wondering if, I like that idea, and I've done that a little bit, but I was also wondering if anybody had done sort of more outreach and like a larger scale type of advisory type project where, yeah, as Alice said, using cute cards. But I think that might be interesting to explore. What do people think? Do you think that would be insensitive to do that, or might be useful, or might get people interested?
That's a really neat idea. I feel like it probably really depends on the context, but that's very interesting. Anyone else have any opinions about that? Prescriptions for graphic medicine? And Matthew, I did unmute you, by the way.
Oh, okay. Well, I guess to answer that question, I think that's a great, neat idea. I linked in the chat to ALA's bibliotherapy guide. Like, that's kind of my future next project if I ever finish what I'm working on right now, is to look into comics and bibliotherapy more. Do you want me to answer the question that I raised my hand for, or do you want to stick on this?
Yes. Either whatever you want. You go, whatever moves you.
Okay. We were talking about how do we talk about the benefits and everything of this, and so what I've been doing is, like I just did an introduction to graphic medicine seminar here, where it was open to students, faculty, anyone within the Harvard medical community. And what we did is talked about how comics have been used in medicine so far, what future ideas there might be out there, and then it involves interactive stuff too. So you do some drawing, you do some cartooning to get people comfortable with the idea of telling stories like that. It's also really fun to make collaborative comics because it's like playing that old, I tell them it's like playing telephone, and sometimes the new med students look at me like I'm an idiot. But, and so you get people involved in the creative process, and when they connect, graphic medicine with, oh, this is kind of fun, and it can also be informative, it builds this community around it. Doesn't really help assess the impact, except for people enjoy it, but, so that's what I've been doing.
Well, that's awesome. And just to give everyone a little sneak preview, Matthew and Alice are planning on doing a webinar for us in November, so maybe they'll talk a little bit more about what they've been doing. I'm very excited about that. So Patricia says, NNLM has an InfoRx site. Can we get in with that? We can look into it. I don't even think I even really know what that is, so you're ahead of me, Patricia. Let's see. Does anyone else, okay, so these are the last questions I have up here. List of publications that produce this type of graphic novel, consumer health information. I'm going to link to Alice's blog at the end here. Questions about future research. Is this a preliminary snapshot? The researcher was performing. Where did she go from here? I'm actually not sure about that. If anyone else has any information about that, I'd be happy to hear it, or any other kind of closing comments, put your hand up and I will call on you. Anybody else? Any other final thoughts?
Yo, Patricia here.
Hi.
I was thinking about what people were just saying, what Matthew, I think it was just saying about collaborative comics, and thinking, what if some of us partnered on a collaborative comic about something like Day in the Life of the Medical Librarian, or if we took advantage of the Inktober thing and did a series where with different librarians doing Inktober about the Day in the Life of the Medical Librarian, little sketches sort of thing, and put something together out of that. There's a website that collects collaborative comics, and maybe we could partner to get something highlighted on that in exchange for highlighting some of their work and some of what we're doing or something like that.
I think that sounds really cool, and if people are interested, I could, at the very least, we could put it up on our Sea Currents blog and SEA, and I bet Sarah would post about it on NER's blog. So that sounds cool to me. If anyone is interested, whoever wants to work on organizing that, sounds great. All right, well, I guess we're getting to the end here. So these are just a few graphic medicine resources for anyone who's not familiar with them. We've got the National Library of Medicine Graphic Medicine Exhibition educational resources, the NNLM NER book club kits that Sarah was talking about. There is, oh yeah, I will, Patricia. I'll paste all that. It's everything. There is the graphic medicine website. It's a great place to start, just about everything. Comic Nurse, that's MK Zerwick. Matthew's blog is the Graphic Librarian blog. Alice's website is, that's where she has her database with all of those graphic medicine catalogs. Oh, Patricia, that's great. Yeah, go for it. And then the last thing I mentioned are Michael Green's resources on the Penn State website. There's a resource page and also all of the comics that have been created by students in his classroom. So the next NNLM Journal Club is on clinical research data management. It is on Thursday, October 25th at 2 p.m. Eastern. Our next SEA webinar is on September 6th at 2 p.m. It is a Seaside webinar, Preparedness and Response for Public Health Emergencies, the mission of the Assistant Secretary for Preparedness and Response. And it's in honor of National Preparedness Day. It's with George Porch. He's a Senior Science Advisor at ASPR, and he actually works on a lot of stuff with pandemics and kind of interesting, cool disaster information stuff. So I think it's going to be a cool webinar. So definitely tune in for that one. The recording will be on our YouTube channel in probably a week or two. I'll post that in the chat box as well. And that is about it. Please this is also the evaluation to get your MLA credit. I will also be emailing it to you. And I actually forgot to include a slide with my information, so I'm going to send you all my email. Please email me, get in touch with me if you have any questions. And thank you for bearing with me with a little bit of technical difficulties. I apologize, but I think it went all right. So thanks so much, everybody.
Thank you.